This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Okay, so I've got a medical minute for you guys, which is, simply said, don't sedate your dislocations and fractures, right? That sounds really cruel, right? To be able to do a dislocation reduction or a fracture reduction without putting the person to sleep, because I think that's been our practice for a very long time. But simply said, you don't need to do it. There's a much easier, much better way, and the patient wakes up in less pain. So what is that? You just block them. No, ketamine sedation. You just block them. So for some of our most common fractures, like a fractured wrist or a fractured, let's say a fractured ankle, if you just take 2 minutes and bring some lidocaine in the bedside, and we just do a common injection, it's been shown that, one, you get great pain control, so you don't need to give them as much morphine or Dilaudid or all the other stuff we use to treat fractures with. 2, after you give them 10-15 minutes and a little coaching, you can usually just reduce their fracture. And then the best part is when they wake up, they don't have all this pain from being manipulated because they're already numb. So for some of the most common ones, for shoulder dislocation, this is really something where we could do a simple scapular injection and numb the scapular nerve, and they get really good anesthesia of the dislocated shoulder. For ankles, we do hematoma blocks. And has anyone done a hematoma block with me yet? I don't see anyone. So I've done this on my last 4 trimalleolar fractures, and we've saved respiratory and you guys a bunch of time just because we do a good job numbing them up. And the landmarks are super easy. It's like there's only 2 bones that are broken. You just inject right before the lateral malleolus, and then you come over, and between the medial malleolus and the anterior tibialis tendon, which is very obvious on most people, it's this big thing right here. You just inject between there, and patients get great anesthesia. And then, of course, the wrist is really simple. You just feel the bone and break and block it. You can block any fracture. So if you have like a midshaft humerus fracture, old lady foul or old guy foul, those are obviously super painful, and we don't do much for them, right? So I think one of the things that you guys can help propel our culture forward is ask the doc to do a block on that person, because we should be doing more of them. Okay, cool. That's it.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.